Hi, this is Dr. Schwartz. Today we're going to talk about management of benign results after breast biopsy. Now remember, there are two possible types of breast biopsy, a surgical biopsy and a core needle biopsy. A surgical biopsy is where we actually perform an operation to sample the tissue in question to get a diagnosis. A core needle biopsy is a needle that's placed into your breast, typically in the office or in the radiology suite, to obtain a diagnosis from a lesion that's seen on imaging. Now, after a surgical biopsy, the results can be completely benign, and your breast surgeon can just recommend that you return to annual screening mammography. Or there may be some abnormal cells seen on your biopsy, and he or she may recommend that you see a medical oncologist to discuss taking a medicine that will reduce your risk of breast cancer in the future. After core needle biopsy, the results also may be benign, and you may not be recommended to do anything else except return to your annual screening mammogram. After core needle biopsy, your results may be completely benign, and your breast surgeon may recommend that you return just to annual screening mammography. Other times, the results are benign, but a surgery is still recommended to remove the lesion in question. Why? Some lesions, as radial scars or papillomas, end up being malignant when we remove them surgically. In other situations, after core needle biopsy, atypical cells are seen on your biopsy, and these are also recommended to undergo complete excision to rule out an underlying breast cancer. In this situation, even if after surgical excision the results are still benign, just demonstrating atypical cells, you're still recommended to see a medical oncologist to discuss the use of a medicine that will reduce your risk of breast cancer in the future. Now, the surgery to remove a breast lesion is quite simple. Typically, you go to the radiology suite or the mammography center for a wire placement into the lesion in question. You're then transported from the radiology center to the surgery center where I operate on you to remove the lesion and the wire in question. The operation is short, typically 20 minutes, and we leave a small surgical scar that heals really nicely and is well hidden. The recovery from the surgery takes 2 or 3 days, and you're back to your normal activities at that time. You'll see me in the clinic a week later where we'll discuss the pathology results and go over the next steps. Thank you for watching. If you like this video, don't forget to subscribe and hit the notification button.